1. Which of the following problem is mostly associated with osteoporosis? A. Infection in the bone. B. Peripheral blood clot formation. C. Fracture formation. D. Painful joint inflammation. 2. A patient presents with abdominal pain that is initially periumbilical but over time moves to the right lower quadrant area. Which of the following clinical condition is most likely suspected? A. Appendicitis. B. Cholecystitis. C. Hood. D. Diverticulitis. 3. Which one of the following insulin injection area has the greatest speed of absorption from its site? A. Abdomen. B. Arms posterior surface. C. Hips. D. Thighs anterior surface. 4. A 20-year-old man comes to a hospital with diabetes mellitus. After arrival and detailed assessment, the patient's every organ system of the body become affected. Which one of the following is macrovascular complication? A. Coronary artery disease. B. Diabetic nephropathy. C. Diabetic neuropathy. D. Diabetic retinopathy. 5. Which of the following is the most common confirmatory diagnostic mechanism of fracture? A. Physical examination. B. History taking. C. Laboratory tests. D. X-ray radiography. 6. A 35-year-old patient is brought to a hospital with a diagnosis of pneumonia following a recent intrathoracic surgery. Which of the following drug is most likely prescribed? A. Gentamicin. B. Amoxicillin. C. Levofloxacin. D. Doxycycline. 7. What is the process of removing as many microorganisms as possible from the hands and arms by mechanical washing and chemical antisepsis before participating in a surgical procedure? A. Antiseptic hand rub. B. Hand antisepsis. C. Hand washing. D. Surgical scrub. 8. Your patient is experiencing congestive heart failure. What medication would you expect to administer to strengthen myocardial contractility? A. Nitroprusside. B. Digoxin. C. Nitroglycerin. D. Furosemide. 9. Which of the following is an example of type 4 hypersensitivity reactions? A. Allergic rhinitis. B. Asthma. C. Atopic dermatitis. D. Contact dermatitis. 10. One of your patients is awaiting lab results for kidney function. The patient has recently recovered from a streptococcal throat infection. Which one of the following kidney disorders might the patient have? A. Chronic renal failure. B. Glomerulonephritis. C. Acute renal failure. D. pyelonephritis. 11. Which one of the following diagnostic procedures is the direct inspection and examination of the larynx, trachea, and lower structures through either a flexible or a rigid scope? A. Bronchoscopy. B. Endoscopy. C. Magnetic resonance imaging. D. Thoracoscopy. 12. Which of the following procedure requires strict aseptic technique? A. Catheterization. B. Retention enema. C. Cleansing enema. D. NGT insertion. 13. Which one of the following vital sign is not affected by diurnal variations? A. Blood pressure. B. Body temperature. C. Respiratory rate. D. Pulse rate. 14. Which WHO clinical stage is suitable for an HIV-positive patient with extrapulmonary tuberculosis and pneumocystis carinii pneumonia (PCP)? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. 15. A 24-year-old woman is brought to a hospital with a diagnosis of blood disorder. On laboratory analysis, hematocrit become 55%. Which type of blood disorder will explain it? A. Hemolytic anemia. B. Iron deficiency anemia. C. Aplastic anemia. D. Polycythemia. 16. Which of the following is not a route of hepatitis B transmission? A. Blood contact. B. Sexual contact. C. Animal contact. D. Perinatal transmission. 17. What would be the first-line emergency management of a patient with acute asthma? A. Aminophylline. B. Hydrocortisone. C. Oxygen. D. Salbutamol. 18. With RO, Hannah is a known chronic kidney disease patient with urine output of less than 300 milliliters per day. How do you report with RO Hannah's finding? A. Anuria. B. Nocturia. C. Oliguria. D. Polyuria. 19. A physician ordered 1,000 milliliters of normal saline to run over 6 hours. What is the drop rate per minute to administer the fluid? A. 41 drop per minute. B. 42 drop per minute. C. 52 drop per minute. D. 56 drop per minute. 20. With RO, Alematu has metastasized uterine cancer and she is terminally ill. Upon assessment, she says, "I feel fine." In which stage of death is with RO Alematu? A. Bargaining. B. Anger. C. Depression. D. Denial. 21. Which of the following is the most common cause of acute osteomyelitis? A. S. aureus. B. Gram-negative rods. C. H. influenza. D. Enterococci. 22. A 35-year-old man brought to a hospital with car accident on his lower leg. On physical examination, he has open fracture on it. What is the preferred method to control bleeding on the site? A. Direct pressure. B. Indirect pressure. C. Elevation of the affected limb. D. Apply tourniquet. 23. Which of the following routes of drug administration has fast onset of action? A. Intramuscular route. B. Intravenous route. C. Oral route. D. Subcutaneous route. 24. Mr. Alamu has cervical spine injury. What maneuver is recommended for airway management? A. Head tilt and chin lift. B. Jaw thrust. C. Chin lift. D. Head tilt. Chin lift and jaw thrust. 25. Which of the following drug is used for managing non-cardiogenic anaphylactic shock? A. Adrenaline. B. Atropine. C. Dopamine. D. Dobutamine. 26. Which one of the following investigation is a golden standard test for TB? A. X-ray. B. AFB. C. CT. D. Culture. 27. With RO Ababek comes to your institution within an hour of ingestion of rat poison. What will be the emergency management of this patient? A. Cleansing enema. B. Decompression. C. Gastric gavage. D. Gastric lavage. Which one of the following is positive clinical finding of meningitis? A. Brudzinski sign. B. Fever. C. Headache. D. Vomiting. 29. A 35-year-old patient comes to your health facility with BP 190/110 mmHg. PR 72 BPM. RR 18 breath per minute into 35 degrees Celsius. Which of the following is correct about this finding? A. Stage 1 hypertension. B. Stage 2 hypertension. C. Systolic hypertension. D. Stage 3 hypertension.